regeneration therapies. Tracy's had a lot of experience working with cancer patients and in this area of that we're dealing with here that we talked a lot about tonight. So she's going to tell us a lot about what we can do. So Tracy, welcome.
Thank you.
I'm going to keep doing this. Slides here.
Great. Everybody hear me okay?
Yeah. Yes.
So thank you for having me. And thank you, Jack, who I met at Pierce County Survivorship meeting several, I guess it was a couple months ago now.
In August.
For bringing me in and allowing me to come talk with you all this evening. It's very exciting for me to be here. My previous work, the last 15 years, I practiced in Illinois. And one of the hospitals that I worked at for the last 9 years, I was fortunate to establish relationships and have the opportunity to work with us two chapters in Illinois. And I probably presented and got to know the men in the groups there over a 9-year period. You know, I'd see them a couple times a year. So it's nice to now be here in the Pacific Northwest and realigning with us two. You have an unbelievable organization, and fortunately for the work that I do within prostate cancer, I think you have one of the best national support groups across the nation. So I have been, as I mentioned, practicing naturopathic medicine for the last 16 years. The last 9+ have been solely working with cancer patients. My area of expertise and clinical practice revolves and focuses on genitourinary types of cancer. Predominantly, probably 75–85% of the gentlemen and patients that I see have prostate cancer. So today, one of the things I wanted to talk about was, one of the most common things I hear is, now that I'm under treatment stabilizing disease, treatments fighting disease, treatments curing disease, but side effects, symptoms come up that are drastically affecting your quality of life. And we're going to talk about, if we could talk about every single possible side effect, I would love to do that. We'd be here for the next 12 hours. So really, my focus is to highlight a few of the most common side effects, talk about some of the possibilities, some of the tools in your bag of tricks that you can utilize to help reduce the severity and frequency of the side effects. This is by no means a complete list. And I am open to discussion. I like to hear everyone's story, so I will roll through the slides, give you the guts of the information, and then be here to answer any questions in regards to your questions and have a discussion as well. Perfect. All right. Okay, so we have to start with the disclosure statement. I am a physician. I'm not here offering specific medical advice to any of you individually. I'm always going to encourage you to consult with a physician to have the best personalized and customized care. So this is not intended as a medical or diagnostic presentation. So who's heard of naturopathic medicine before? Okay. Who has seen a naturopathic physician as a patient before? Okay, so I will give you a brief introduction. We are trained just like medical doctors. We attend 4 years of a naturopathic medical school. We study the same basic sciences, the same pharmaceuticals, how to interpret blood work, labs, diagnostic testing. We are also trained in pharmaceuticals and drugs to know how they work in the body, what's their mechanism, what effect are they having. But we are the only physicians or clinicians within healthcare that study vitamins, herbal medicines, botanicals, nutrients, anything that falls under the category of a natural supplement or a natural medicine. And we study those things just like conventional doctors, medical doctors study pharmaceuticals and drugs. So we look at what is the evidence of this nutrient? What is the evidence of this plant-based herbal medicine or botanical? How much do you have to take to have a therapeutic effect? Is it safe to take without causing a drug-nutrient or drug-herb interaction? And is there evidence to show that it's even effective for specific populations? So the easiest way to look at it at the end of the day, were your physician and clinical experts in regards to natural medicines and anything that falls under the category of natural supplements or natural medicines. Before I get into some of the common side effects, this is the short list. Okay, you know them, you've heard them, you've been told them. Hot flashes, night sweats, muscle aches, joint pains, bone loss, loss of muscle mass, fatigue, erectile dysfunction, urinary changes, sleep disorders, digestive complaints, you name it. These are the most common side effects that come from androgen deprivation therapy, which means you deprive the body of an androgen hormone, testosterone, and these are some of the things that can come up. They come up in men in a variety of shapes, sizes, severity. Some men may have a hot flash or two. It doesn't bother them. Their quality of life isn't affected. Other men are having flashes every hour for 30 seconds, and 6 times through the night they're pulling the sheets off and pulling the sheets back on and opening and closing the windows. So you have both ends of the spectrum, and then you have everything in between. So as we start to go through some of these side effects, I cannot emphasize enough the value in customizing, personalizing the recommendations to meet individuals' needs. You can't just say, oh, you know, this piece of paper here is going to be effective for everybody in the room, and if you all hold this piece of paper, it's going to decrease your hot flashes and night sweats. It doesn't work that way. So we really have to look at each man as an individual, and when we come up with prescriptions, do that with that intent. The other thing to keep in mind is, you know, the old days, we used to talk about androgen deprivation therapy, and it referred to Lupron, kind of one therapy. Now we have Degarelix, and we have other testosterone blockers and testosterone receptor blockers that are going to be at risk for the same side effects. I mention that because you're also seeing a combination of these therapies that have been shown to be most effective to help fight prostate cancer. So what happens when you take one therapy that's already depriving the body of testosterone, and then you top it off with another therapy that's blocking testosterone, you know, at the receptor level? There is a risk and potential for increased side effects. There is also then a risk of increased drug-nutrient, drug-herb interactions. The more prescriptions and drugs you put in the mix, the more cautious you have to be about the natural medicines. Just because natural medicines are safe, it doesn't mean they're safe to take with all types of treatment and all types of testosterone deprivation therapies. Okay, hot flashes, night sweats. Most of the evidence and research, if not all, actually has been done in breast cancer patients. So I don't have any evidence specific to say that men treated with androgen deprivation therapy that have hot flashes, if they try these things, that they've been shown to be effective. The reason we apply them this way is because, one, we look at the mechanisms, and two, what we've done is apply that breast cancer, another hormone-dependent type of cancer, has similar side effects as prostate cancer and prostate cancer treatments. And a lot of the therapies coincide and work the same. Because of my interest in working with this population, I actually have submitted a clinical trial to look at specifically black cohosh here at the top of the list, in does it actually show effect in reducing severity or frequency of hot flashes of men with prostate cancer on androgen deprivation therapy. So we'll kind of keep our eyes out. We always want evidence, more than clinical and anecdotal, so that you know that taking something has been proven to be effective. So one of the things you can consider is acupuncture. So what I like to do when I come up with plans for my patients is I want to give you several options. And I want to give you several options that are different types of therapies. Some people prefer to go and get a therapy, like acupuncture, where they can rest on the table, and the acupuncturist will use very, very, very fine acupuncture needles and work energy pathways to change the vasomotor system, which is what's being heightened with hot flashes and night sweats. So an acupuncturist will use specific techniques. They will hit specific points on the body, throughout the body, on the bottom of the foot, throughout the legs and arms, often in the ears. And the goal in the therapy being, if they can change the energetic pathways, change the energy pathways, you get some relief from hot flashes and night sweats. I do see acupuncture being very effective at this. It's not a one-time shot. It is typically, I say, you're going to want to get a treatment once a week for 3+ weeks before you really start to notice the benefit. Acupuncture also is going to be helpful for a lot of other things. It can help with fatigue. It can help with, improving sleep and insomnia. So another thing to consider is, do these treatments have multiple modalities? So you can better customize it to the patient. So if I have a gentleman who's having a lot of joint pains, a lot of trouble sleeping, and a lot of hot flashes, and instead of taking capsules and pills and focusing on foods and triggers, they just want to go up and get a treatment, acupuncture is a great option for them. When we look into the natural medicines, natural supplement realm, you have several options. One is a botanical or plant-based medicine called black cohosh. This is probably one of the most common things on the market for women that have hot flashes. It's sold over the counter in many different products and different names. Black cohosh, we don't know the exact mechanism of how this works to decrease hot flashes and night sweats. The reason we don't know that is because we still don't know the exact and direct cause of why the hot flashes are there. We know they come on when the hormones are withdrawn from the body. And we know that when the hormones recover, when testosterone starts to rise, if you're off of treatment, that they get better. But we don't know. It's not affecting a temperature regulation system. We've looked at histamine levels. So what we do and what we find is that we do know that the way black cohosh, a plant-based medicine, also has phytoestrogen-like activity, which means it acts like an estrogen in the body, which is how we suspect it may help with these hot flashes. Now, I mentioned that cautiously in that I said estrogen-like. It does not raise estrogen levels. It does not make men or women feel, like they want to go shopping, or they're more tearful and, eat chocolate like us women love to do. But it does mimic estrogen-like activity in the body. It does not change hormone levels at all. So if you take it, you're not changing your hormone levels. The second thing on the list is called Hesperian. And Hesperian is one of the types of bioflavonoids. Flavonoids are these really nutritious, rich nutrients that we get from those colorful fruits and citrus fruits specifically. And Hesperian works along the pathway of, it controls the cells from releasing histamine and having a flushing effect. So if you think about night sweats and hot flashes, often what happens is not only the temperature is dysregulated, there's an internal overwhelming sense of heat, but often there is going to be redness, flushing, potentially sweating, The mechanism or goal of Hesperian is to try and control that so that you're decreasing the amount of histamine that's being released from the cells, so you're decreasing the severity of the flushing, the sweating, the sudden intense heat. Magnesium, very simple, very nice mineral. One of my favorite minerals to use for many, many, many reasons. Magnesium is beneficial for heart health. It can be helpful for joint pains, muscle aches, muscle cramps. It's an important mineral to have in balance with other minerals like calcium for bone health. And it also has been shown to take the edge off the hot flashes. I have never seen any of these supplements or combination of any of these therapies completely eliminate the hot flashes and night sweats. I have seen them get significantly better. I have seen them become much less frequent. I have seen them become much less severe, and therefore, better quality of life because you're controlling how bad things are. But don't anticipate, you don't start these things and then wake up the next day and say, oh, Tracy told me this was going to help me with my hot flashes, but I'm still having hot flashes and I'm taking this. We want to evaluate after about 4 to 6 weeks if they're less frequent, less severe, and more tolerable for you, so you can go on and live your life and not be in a meeting and all of a sudden have a flash. Omega-3 fatty acids, fish oils, have been shown to be effective, working from an anti-inflammatory perspective. Omega-3s are great for cardiovascular health, heart health. They also work anti-inflammatory pathways. So when we look at decision-making process of what am I going to choose, what am I going to start with, the gentleman is on hormone therapy, at risk for cardiovascular disease, also has high inflammatory profiles, a lot of joint pains. We know cancer is an inflammatory process. Omega-3s might be something I want to consider to get multiple effects and affect different organ systems. Omega-3s is also a good place to talk about these risk of drug-nutrient interactions, or a case where certain supplements would be contraindicated. And omega-3s, fish oils, do have the ability to thin your blood. So if I have a patient that's on anticoagulant therapy, Coumadin, warfarin, blood-thinning medication, this is not going to be my first choice because there's a drug-nutrient interaction and I'm at risk of putting their coagulation pathways at risk for problems and complications. So, lifestyle factors. This one, we hear the common things: hot, spicy foods, changes in temperature of a room, inside or out, stress, emotional or physical, physical activity or emotional stress, a difficult meeting or difficult conversation can often trigger hot flashes and night sweats. So learning how to manage those individually, layer your clothes, avoid the spicy food. Alcohol can be a trigger for some men, so it becomes a reality of that if you're going to go mow the lawn and have a beer, and that always triggers a hot flash for you, think about what you can do differently. Joint pains, another very common effect of the deprivation of testosterone. The cause of the joint pains can be for a lot of reasons. Sometimes men already have osteoarthritis or breakdown and wear and tear in the joints. Inflammation that we talked about earlier can worsen and aggravate joint pains, as well as the withdrawal of the testosterone, which causes a loss of muscle mass, can potentially aggravate joint pains. Some supplements that you can look at: glucosamine and chondroitin. These are some of the better known, that what they do is they help maintain that cushion that lies in between the joints so that you don't have bone wearing on bone, which causes a lot of pain, typically in the bigger joints, the knees, the hips, shoulders, elbows. The joint pains can also be due to an effect of metastatic disease. You all are aware, prostate cancer, most common site of metastatic disease, or where is it going to go next, where is it going to spread, is typically to the bone. So when the joint pain is due to disease in the bone, very different and different lines of approach that when the joint pains are due to inflammation or withdrawal of testosterone. So again, noting the mechanism is going to be helpful in deciding what you're going to recommend. Are you going to use topical agents? Are you going to use oral supplements? The biggest anti-inflammatory that I have that I love to use is called bromelain. It's an extract of pineapple. That extract is what has that anti-inflammatory activity. I have men use this similar to how you might use, ibuprofen, a non-steroidal anti-inflammatory, over-the-counter medications. It works very well. Because it is an extract of pineapple, which has that anti-inflammatory component, if you have a sensitivity, digestive sensitivity to pineapple or allergy to pineapple, not going to be something you'll consider. Same goes back for the anti-inflammatories in the omega-3s. Fish oils, come from fish. So if someone has a seafood or fish or a crustacean allergy, shellfish allergy, that's not something I want to consider. Magnesium comes up again. So now you're seeing there's also magnesium that can help with hot flashes and night sweats. Magnesium can also help with joint pains. More specifically, magnesium is my go-to for muscle aches, muscle soreness, muscle cramping, leg cramping, Charlie horses at night, or restless leg, which is if you go to sleep at night, you notice kind of your muscles twitch. Magnesium has a smooth muscle relaxing effect specific to the muscles. It can also help with bowel movements if there's constipation is an issue as well. Acupuncture we touched on the last slide. Other things you can do for physical therapy would be physical therapy and specifically exercise. Building up, maintaining the muscle mass to take the pressure off of the joints so that you have less pain. Make the muscles do the work, not your joints and the bones. And physical therapists have specific protocols for all of these that they might develop, in addition to a exercise therapist or physical trainer, and even just getting some regular physical activity. Fatigue. Who's tired? Okay, I want to talk to you afterwards. Jack's not tired. So hands down, the most common word, phrase that I hear every day since I've been working with cancer patients: fatigue, tired. It's the first complaint often. It can be due to many, many reasons. The disease process itself is highly metabolic. Cancer cells burn energy and turn over. So they, just by being there and being in the body, are draining our system. They're draining out your tank, emptying your tank, just by having a diagnosis. So that's why across the board, all types of cancer, you'll often hear people say, how are you feeling? What's going on? I'm tired. I'm fatigued. Then you have the treatments of cancer. You take your testosterone away and stop the body from producing it and block the receptor sites. Guess what? You're going to find out pretty quickly what testosterone was helping you in. It was helping with energy. It was helping with you feeling, maintaining muscle mass and feeling mentally alert and strong and physically strong. So when you take those things away over time is when you can also see these things set in. You get your first Lupron injection or Degarelix injection. It's not an immediate effect of come tomorrow. I don't typically see men feeling tired then. It's when they've been on treatment for several months and several years and the system's depleted and drained and we need to refill the tank. Fatigue, another place to look at concomitant therapies. On a treatment for prostate cancer, androgen deprivation therapy, and maybe also having undergone radiation therapy. After 6 to 8 weeks of radiation, men may feel more fatigued than they did prior to. So, number one thing, hands down, if there is one area of evidence that there's thousands of studies that have been done, and thousands of studies and clinical data and evidence all comes out positive and says the same thing, that says when cancer patients can maintain some level of physical activity to their tolerance, maintain exercise. If it's something as simple as walking, if it's something as simple as, as a short jog, any sort of cardiovascular activity to get that heart rate up. Exercise, 100% across the board, comes back to the patients that maintained and did some form of exercise through treatment had less fatigue, less severe symptoms, complications, and side effects across the board of what they were, better mental outlook, better sleep, better maintenance of muscle mass. So, this is something we all need to do. Unfortunately, when I tell some patients, and they tell me they're tired, and I tell them that they need to get exercise, I'm pretty sure that one time I may have to duck because they're not going to want to hear that. But there is some truth to it, and finding the balance of push yourself to the level of activity where you're going to push yourself to stimulate energy metabolism, but not push yourself to the point of where you're going to be draining and depleting, because then you're going to be more tired. So I can't answer where that level is for each and every individual. The only way I can answer to them is asking them about where's your physical activity level today, and how are you breathing through those physical activity levels. And your monitor should be, you should be for about 20 minutes every day, something that gets your heart rate up, which means your breathing is going to increase, not to the point of being short of breath, but so that you're stimulating the body to get that heart rate up. There are plenty of natural medicines that can affect energy metabolism, maintaining energy, decreasing how severe the fatigue is going to be. They all work from different mechanisms. B vitamins, and it is the complex of the B vitamins that I see more effective than just taking B12. B12, unless there's a proven deficiency, is not going to change anyone's energy level if the cause of the fatigue is because of testosterone withdrawal or treatment of the prostate cancer or the cancer itself. You can take all the B12 in your on, it's probably not going to change things. But the complex, there's many different B vitamins, and the reason that they're important is because they're the cofactors, they're the precursors that we have to have in our system in order for our body to metabolize and make energy. So if you don't have B vitamins on a cellular level, your body is not going to produce and metabolize energy as effectively as if you're taking a supplement. It's hard to get B vitamins through food. They're very limited, they're very low dose, so most often I put, if fatigue is of the highest concern, and that's why someone's looking for help, I'll put them on a really good quality B complex vitamin. It'll be something they'll be on for a long term, and I do see fairly good results with that. L-carnitine is an amino acid that's specific to heart health. And I put this one in because one has been shown to improve energy metabolism, but it also helps to protect cardiovascular function, how your heart works, how it functions, maintaining the pumping of the heart. And the reason that's important is because androgen deprivation therapy, there is cardiovascular disease risk the longer a man is on androgen deprivation therapy.